My name is Graham McLaren.
My name is Ramanathan KR.
I'm the director of the Cardiothoracic Intensive Care Unit here at National University Heart Centre in Singapore.
I'm the director of the CT-ICU Fellowship Program.
I'm Dr. 𝒚𝒐𝒖𝒓 Bastola.
I'm Dr. Bishwavikas Mohanty.
I am currently a clinical fellow in the Department of Cardiothoracic Intensive Care Unit.
As a former CT-ICU fellow,
I have been working here since 2007 and have been the director ever since 2008.
I'm also a senior consultant here in Cardiothoracic ICU at the National University Heart Centre.
I'm from Nepal and I've been here for almost 9 months now in the fellowship program.
I'm now working as a consultant critical care medicine and in eastern part of India.
The CT-ICU Fellowship Program has been running for about 13 to 14 years now. We have candidates coming from all parts of the world.
If I were to describe the CT-ICU program in one word, it would be exemplary.
Comprehensive.
Inspiring. Our fellows get to look after some of the sickest patients, usually young patients in the country, get exposed to a wide variety of critical illnesses. We also run a program for extracorporeal membrane oxygenation, essentially a heroic form of life support used to stop the most critically ill patients from dying. Many of them go back to their home countries and they set up their own ECMO programs.
Fellows would have opportunities to learn the nuances of cardiac critical care. They would come across patients who have had complex cardiac surgeries, minimally invasive cardiac surgeries. They also have the opportunity to learn on bedside echocardiography, advanced monitoring tools, advanced devices such as IABP, pacing.
The program applies an evidence-based practices in daily care of the patient. It is under the guidance of the field experts. We get to meet doctors from different specialty backgrounds and then have an opportunity to mingle with them and then refine our own knowledge. The ability to practice evidence-based medicine is something that we as Nepalese back home weren't able to do due to many limitations and constraints. Whereas over here, I could experience that in its fullest. The other difference that I would like to highlight is the use of cutting-edge technology for diagnosis and management of patients. And thirdly, the availability of medical facility at the point where the patient needs. That is something that is really important in managing patients for saving lives.
During the fellowship program, the fellows obviously get exposed to a lot of technical aspects of medicine, but it's also important to stress that they acquire some soft skills, the ability to communicate effectively with patients and their families, the ability to use our computer system called EPIC.
ICU itself is a very dynamic environment, so each and every moment could be a turning point for the patients. The clinical skills that I would like to mention that I've learned so far are the bedside care, which is one of the most simple yet difficult to learn. On top of that, I would say the knowledge of the ultrasound machines, the knowledge of the machines that we use on patients on ECMO. This care provides us an opportunity to identify things in advance so that we can prevent things happening to the patient and accordingly manage them better.
There is a lot of simulations-based training. What I learned from the simulation, this is very important, which we'll never find except from Singapore. The clinical skill and the complex situations, what I have learned from my CT-ICU fellowship program, that helped me a lot to handle all the types of critical patients right now in India.
So fellows who have trained with us go back to their country, they set up an ICU or an ECMO program and they lead from the front. They are also key opinion leaders in their country on aspects of critical care management. As a director of the program, I believe we are clearly learning the art of how we create future leaders in this domain.
People from different countries with their own cultures, they come together in one platform, which is one of an opportunity for us to know people from other countries as well and build up a rapport and relationship which is sort of long-lasting.
The culture in CT-ICU is more of a friendly culture. They work with colleagues from variable backgrounds who have variable degree of experience. They get to interact with multidisciplinary teams, nurses, and allied staff, and they build a nice camaraderie in that process.
Before coming here, I was very apprehensive about the new place and everything. But towards the end, I feel I have started to miss the fellowship program already because of the immense gratitude that the people have shown me. On top of that, the knowledge and the skill that I've gained through the entire program. I will carry on this for my lifetime, and I would encourage people to be a part of it.
I'll highly recommend everyone to join the CTISU fellowship program on the ECMO, which enables me to be an expert ECMO physician right now.
The CTICU fellowship program stays with our doctors long after they've left Singapore. We keep in touch with them and they keep in touch with each other. The fact that they were once worked here stays with them.
All in all, I would say that this fellowship program is one of its kind in this region.